In our community, Alzheimer's and dementia have affected many of us, and nationwide, the numbers are staggering. Let's take a quick look at these highlights, why the work we do is so important and needed now more than ever. Here's the latest statistics on Alzheimer's disease and the prevalence, mortality, caregiving, and cost of care. It's important to note that these statistics represent Alzheimer's disease alone and do not reflect all other forms of dementia. As you can see, that our mission for the Alzheimer's Association leads the way to end Alzheimer's and all other types of dementia by accelerating global research, driving risk reduction and early detection, and maximizing quality care and support. Okay, so just to make sure we're all on the same page with some important definitions, our mission, that dementia is the general term for a loss of memory, thinking, language, problem solving, and other abilities that are severe enough to interfere with daily life. Alzheimer's is the most common cause of dementia. Dementia is not a single disease. It is an overall term, like heart disease, that covers a wide range of specific medical conditions, including Alzheimer's disease. Disorders grouped under the general term dementia are caused by abnormal brain changes. These changes trigger a decline in thinking skills, also known as cognitive abilities, that are severe enough to impair daily life and independent function. They also affect behavior, feelings, and relationships. Alzheimer's disease accounts for 60 to 80% of cases. Vascular dementia, which occurs because of microscopic bleeding and blood vessel blockages in the brain, is the second most common cause of dementia. Those who experience the brain changes of multiple types of dementia simultaneously have mixed dementia. And there are many other conditions that can cause symptoms of dementia, including some that are reversible, such as thyroid problems or vitamin deficiencies. Okay. So what is Alzheimer's? It is the most common cause of dementia. It is not a normal part of aging. The greatest known risk factor to Alzheimer's is increasing age, and the majority of people with Alzheimer's are 65 and older. Alzheimer's disease is considered to be younger onset Alzheimer's if it affects a person under 65. Younger onset can also be referred to as early onset Alzheimer's. People with younger onset Alzheimer's can be in the early, middle, or late stage of the disease. Alzheimer's worsens over time. Alzheimer's is a progressive disease where dementia symptoms gradually worsen over a number of years. In its early stages, memory loss is mild, but with late-stage Alzheimer's, individuals lose the ability to carry on a conversation and respond to their environment. On average, a person with Alzheimer's lives 4 to 8 years after diagnosis, but can live as long as 20, depending on other factors. Often, dementia will start out slowly and gradually get worse. If you or someone you know is experiencing memory difficulties or other changes in thinking skills, don't ignore them. Even if the symptoms are mild, see a doctor soon to determine the cause. There are benefits to receiving an early and accurate diagnosis, including an opportunity to plan for the future, to access support services, and also to explore treatment options. If you notice any of the warning signs of Alzheimer's disease in yourself or someone you know, schedule an appointment with your doctor. The earlier someone is diagnosed, the more treatment options may be available. Some medications are only effective in the early stages of the disease. Additionally, when caught early, some lifestyle changes, such as controlling blood pressure, stopping smoking, participating in exercise, and staying mentally and socially active, may help preserve cognitive function. Receiving an early Alzheimer's diagnosis may help lessen anxieties about why someone is experiencing symptoms. With early detection, families also have the opportunity to maximize time together and access resources and support programs. Because Alzheimer's and dementia have such profound effects on individuals, families, and whole communities, all of us should be equipped to recognize the warning signs. There are 10 key warning signs and symptoms of Alzheimer's, which can be subtle. It is possible for individuals to experience one or more of these signs in varying degrees. It is not necessary to experience every sign in order to raise concern. So a few of the signs are trouble understanding visual images and spatial relationships, decreased or poor judgment, and also may happen is changes in mood or personality. There is exciting progress in Alzheimer's and dementia research that is creating promising new treatments for people living with the disease. The U.S. Food and Drug Administration has approved medications for Alzheimer's. These fall into two categories: drugs that temporarily ease some symptoms of Alzheimer's disease, and drugs that change disease progression in people living with Alzheimer's. Two FDA-approved treatments demonstrate that removing beta amyloid, one of the hallmarks of Alzheimer's disease, from the brain reduces cognitive and functional decline in people living with early Alzheimer's. Today, there's a worldwide effort underway to find better ways to treat the disease, clearly its onset, and prevent it from developing. When thinking about any treatment, it is important to have a conversation with a healthcare professional to determine whether it is appropriate and weigh potential benefits and risks. A doctor who is experienced in using these medications should monitor people who are taking them and provide information that can help people make informed decisions about their usage and care. To prevent drug interactions and unwanted side effects, it's important that the person's doctor, pharmacist, and care team are aware of all medications being taken, including over-the-counter and alternative remedies. In some communities, the risk for Alzheimer's is even greater. Studies show that Black Americans are twice as likely as white Americans to develop Alzheimer's, and Hispanic Americans are 1.5 times more likely than non-Hispanic white Americans to develop the disease. Members of underserved, diverse communities are more likely to endure poverty and have more limited access to quality health care. They are also less likely to pursue a diagnosis, receive support, or participate in a clinical trial. Alzheimer's also has a disproportionate impact on women. In the United States, more than 11 million women are either living with Alzheimer's or caring for someone who has it. And almost 2/3 of Americans living with Alzheimer's are women. Women in their 60s are more than twice as likely to develop Alzheimer's disease over the rest of their lives as they are to develop breast cancer. At the Alzheimer's Association, we believe that diverse perspectives are critical to achieving health equity, meaning that all communities have a fair and just opportunity for early diagnosis and access to risk reduction and quality care. The association is committed to engaging engaging underrepresented and underserved community and responding with resources and education to address the disproportionate impact of Alzheimer's and dementia. Adult children and spouses of people living with dementia often serve as primary caregivers. It can be challenging for all family members to accept changes in their roles and responsibilities. The demands of caregiving can limit a caregiver's ability to take care of themselves. Family caregivers of people with Alzheimer's and related dementia are at greater risk for anxiety, depression, and poor quality of life than caregivers of people with other conditions. Additionally, the lifetime cost of care for individuals with Alzheimer's is more than twice the amount incurred by individuals without Alzheimer's. In addition to exciting advancements in treatment, is more research every day about the importance of brain health to reduce the risk of Alzheimer's disease and dementia. There are several risk factors for cognitive decline and dementia. Some, such as age, we can't control. Research is still evolving, but evidence is strong that people can reduce their risk of cognitive decline by making key lifestyle changes, including participating in regular physical activity, staying socially engaged, and maintaining good heart health. When possible, combine these habits to achieve maximum benefit for the brain and body. Start now. It's never too late or too early to incorporate these healthy habits. These 10 healthy habits are good for brain health. Do as many of them as you can for maximum benefit. So get moving, eat right, protecting our head, sleeping well, stay in school, challenging our mind is just a few. So how can the Alzheimer's Association help? I want you to make sure that you all know that the Alzheimer's Association can help and you and your community. Our 24/7 helpline is not a 911, as Dr. Mercury had shared. And thank you for sharing that, because we don't think of that either when we're out in community. We don't think of telling people this isn't only for emergencies. You can call this number anytime with any question that you might have. It is confidential. They are open 365. So again, yes, you can call at 2 o'clock in the morning and ask your question, however small or big it might be, and somebody will be there to answer your questions. We also have free education and support, so you can find dementia and aging related resources such as support groups that connect individuals facing dementia at our website, and our website is alz.org. For North Dakota folks, professional caregivers and family caregivers, there are services that are available to you. And if you are interested in learning more about our services, you can call that helpline number, or you can contact Joan Danks or myself for more information. And here's just a quick snapshot of what services we do provide for professional North Dakotans and professional caregivers and family caregivers as well. And again, you can contact Joan Danks or myself for more information. So how can you help join the cause for the Alzheimer's Association? You can help us realize our vision of a world without Alzheimer's and all other dementia. The association has a variety of volunteer opportunities available to fit all interests, skills, and experience levels. You can use your unique talents to make a meaningful impact in your community while connecting with others who share your passion. Whether you want to get involved as an individual or volunteer with your service club, organization, or maybe even your company, or you need some support for your family, friend, or neighbor, the Alzheimer's Association is here for you. So contact the Alzheimer's Association to find the role that's best fit for you. Of course, we have our walk to end Alzheimer's, and we also have the longest day. Both are wonderful fundraisers for the Alzheimer's Association. And so if you are available and you know that there's a walk team, or you know there's longest day events, please join us, join in our mission and participate in either of those activities. I hope you walk away from this little presentation having learned something you can use or share with someone who can. I look forward to hearing from those who are inspired to do more to help the Alzheimer's Association and creating a world without Alzheimer's and other dementia. Thank you all for your time this afternoon.